For endo suturing practice, we are using the remaining suture material which is left after episiotomy repair is done, that is Vicryl Rapid we are using for the practice. So here it is collection of waste suture material for practice. Now for doing this practice of suturing, we have this different kind of materials. This is ready-made available from company people. This is self-made, that is a cloth which we have cut, can be sewed, or you can make a single cut and do suturing practice. This cloth is then shifted into that box, or if you have that own made self box, you can put that inside and do suturing. So here we are starting this pelvic training exercise especially for endo suturing. So in endo suturing, the first step is to put the suture material inside abdomen. We will discuss this topic, putting suture material inside abdomen, separately as a part of training. So here we are not discussing how to put suture material in abdomen, but we will focus on how to do suturing practice. Once the suture material is inside abdomen, we generally do practice like this: to hold the needle, then adjust needle, then you will hold the tissue with one tooth grasper, and with dominant hand you are piercing the suture material, not with the force but in a movement of curve of needle. Means you are just doing supination pronation movement. You are rotating your hand, and with that rotation the needle will pierce the tissue. Because it is a round shaped needle, it will pierce with rotation movement, not with the force. Then with baby step you are pulling the suture material, keeping an eye on distal end also, that the distal end doesn't come out with pulling out, and you are not pulling too much of this suture material, otherwise you may come out taking the suture material out of abdomen, so out of this box also. So baby step movement to pull suture material. Then you are making a knot, because we are doing this, and we are not doing strapping in surgery. We are making first square knot, means two type rotation, then reverse, then again one third knot, and this is done. And you have to practice this for multiple times to get trained. Generally it is done as a practice like this way, and most of the time everyone gets fatigued with doing this kind of exercise, and they can't get anything out of this exercise, or it takes much longer time to get trained for endo suturing. Instead of doing this long task, you have to divide this task into multiple small tasks. So multiple small tasks means divide this all long task into only just learn to hold needle. That task, second task will be accordingly. So we will discuss accordingly. So I have specially kept one needle for this purpose only, or you can do with the similar same needle also. We have another needle with very short suture material. So just train yourself how to hold needle. So always with non-dominant hand hold with the suture, then with the dominant hand hold the needle. Then if you want to adjust, loosen the needle and adjust accordingly. If you want to center of the needle, or you want to change any angle of the needle, you can do with the suture material, holding needle very loose. So practice these things initially. Just learn to hold needle. Again release everything. Once it is perfectly done, release everything. Means it is perfect. Now it is perfectly hold. Now release, drop it. Again hold suture material, then hold the needle, then again learn to adjust needle, This is the exercise you need to do for minimum 100 times before jumping for the next step. Again then 2 times, then it is third time, then fourth time, fifth time. Keep on doing this exercise till you are confident to hold needle. Once it is done, then step 2 will be to learn to pierce the tissue. So now we are going towards the second step. This is demo purpose, so I am directly jumping for second step. If you are doing pelvic training exercise, just do first step only. So this is forceful, only force was applied, so it was superficial. Now it is forceful rotational movement. So because of rotation, it pierces the tissue deep and it comes out easily. Here it is coming out, and you just, in actual surgery, your passive hand also helps in this task, but here the material is so that the needle is not slipping, needle is not moving, needle is not going anywhere else, so it is easy and with low risk. But in actual surgery, your passive hand is also needed to help in this piercing action. That a passive hand will hold the tissue also, that can give force against needle also, that will hold needle when it comes out also. All these things can be done with passive hand also. So second step will be learn to pierce tissue. So when you are doing this second step, automatically you are doing exercise of first step, means holding the needle and piercing the tissue. So 2 steps together. Once it is done, you will move towards the next steps. Now you are going towards the next step. So next step is again hold the needle. You are holding needle, then you are piercing the tissue. You are doing pronation and supination movement. Here my cameraman is we are sharing. I will try to put video that movement of hand also. It is not force, it is rotation of hand, that is pronation and supination. This is rotation of the hand, forearm, and it will come out. Along with that, you are also doing baby step to pull the suture material. So hold the needle, pierce the tissue and pull the needle out, and then do baby step to take out the suture material. This will be again a long task, but you are doing this task only. Just pull out by baby step. You are not pulling it too much. Again do same, hold the needle, then pierce the tissue, then pull the needle and do baby step. If you are doing too much, then it may come out. So baby step. Now third step will be to make suture. So for making knots, you need to make C loop. This is in opposite C loop, means reverse C loop. And here again also you just practice of making knots only. You can break this to only do knotting practice. I have made knot, I have released knot also, and again I am making the same. Make C loop, rotate twice and pull the suture from its tip. Again pull it towards the opposite side, and it is done. Again do same for multiple time. So multiple time doing your knotting practice only. Once square knot is done, you are going to do the next opposite knot. Actually I also learned to put right knot when I started doing laparoscopy. Otherwise I was not aware of whether I am making a right knot or wrong knot. So with laparoscopy we are looking at knot position, whether it is right or wrong. So you are making right knot means it is properly placed knot. So learn to make square knot, then opposite knot, then again third knot, and again fourth knot. Keep on doing knotting practice with dominant hand. You need to train yourself for working with the opposite hand also. So same things can be done with opposite also. Initially you may find difficulty, but train yourself, make C loop for that also. So it is short, you need to make it long, the loop should be long. The C loop, you are pulling the suture, so you are using this, you are doing the same task with opposite hand. I am also finding little bit difficulty when I am doing the knotting practice with the left hand, so slightly tedious when you are not used to do the same thing, but with practice you can make it, you can do it with both the hands. So train yourself to do work with both hands. When knot is placed, learn to tighten also, so hold the suture material and pull in opposite direction. So this exercise has to be done every day for minimum 30 minutes to 1 hour, preferably is 1 hour suturing practice. You may get shoulder pain, then stop, otherwise not. Thank you.